Hello, my name is Dr. Sanjay Ghosh, and today I'm going to talk to you about the lateral lumbar interbody fusion, also called the XLIF in some situations. The lateral lumbar interbody fusion is a technique to access the spine and replace the disc going through a flank incision through the side. As you can see on this diagram, it's depicted here. There's typically two separate incisions that are made in the flank. The spine is then accessed through the side, and the critical structures that are navigated include the intestine, the ureter, and the great vessels, the iliac arteries and veins. Once the disc is accessed through a narrow channel or port, the disc is then removed and it is replaced with a PEEK or plastic cage. The center of the PEEK cage is generally packed with the patient's own bone and synthetic bone. This can then be further stabilized with screws and rods to stabilize the fusion. The advantage of the XLIF approach is that it avoids the need to excessively manipulate the intestines, and it also avoids the need for manipulation of the great blood vessels. The disadvantages of the XLIF procedure, however, are that it is not possible in general to get down to the L5-S1 level due to anatomic constraints, and it is not possible to do a meaningful decompression for lumbar stenosis with this technique. So patients that have the XLIF for lumbar stenosis typically need a secondary procedure that addresses the stenosis by a posterior approach.